What is an adenoma found during a colonoscopy? Imagine discovering a tiny bump or growth inside your colon during a routine checkup. That's often what happens when a doctor finds an adenoma during a colonoscopy. A colonoscopy is a procedure where a doctor uses a flexible tube with a camera to look inside your large intestine. It helps find issues like polyps or inflammation. An adenoma is a type of polyp, which is a small growth that forms from the lining of the colon or rectum. These growths are made of glandular tissue, which is normal in the lining of your intestines. Most adenomas are benign, meaning they are not cancerous. But they are considered precancerous because they can change over time and become cancer if not treated. Most adenomas don't cause symptoms. That's why they are often found during screening colonoscopies, especially in people without any signs of trouble. Sometimes, though, they can cause symptoms like rectal bleeding, which might show up as bright red blood in the stool. Larger adenomas can cause changes in bowel habits, such as diarrhea or constipation that lasts more than a week. If a polyp grows big enough, it might block part of the bowel, leading to cramping or pain. Another sign can be iron deficiency anemia, which happens when slow bleeding from the adenoma causes your blood levels to drop. Some people might notice mucus in their stool or even lose weight without knowing why. When a doctor finds an adenoma during a colonoscopy, they usually remove it right then and there. This is done with special tools like a snare or forceps, and the procedure is painless because you are sedated. After removal, the adenoma is sent to a lab for examination under a microscope. This helps determine if it is a benign adenoma or if there are any early signs of cancer. Removing adenomas is very important because it lowers the chance of developing colorectal cancer later. People who have adenomas often need to have follow-up colonoscopies more frequently to check for new growths or changes in existing polyps. In short, an adenoma found during a colonoscopy is a small, non-cancerous growth that can turn into cancer if left untreated. Detecting and removing these growths is a key step in preventing colorectal cancer and keeping your digestive system healthy. That's why regular screenings are so important for everyone, especially as they get older or if there's a family history of colon issues.